In this section, we'll focus on sick days and what to do if you forget to take your medication. Let's start with sick days. When a person with diabetes gets an illness such as influenza, gastroenteritis, or any other health problem that could cause dehydration through diarrhea, vomiting, fever, or infection, they need to start their sick day protocol. The first step in the sick day protocol is to stop certain medications. These include metformin or glucophage and Glumetza, insulin secretagogues such as gliclazide or dimicron and dimicron MR, glimepiride or Amaryl, repaglinide or Gluconorm, and glyburide or Diabeta, SGLT2 inhibitors such as canagliflozin or Invokana, dapagliflozin or Forxiga, and empagliflozin or Jardiance, and combinations containing SGLT2 inhibitors such as Xigduo, Synjardy, and Invokamet. If you're taking these medications, your medical team has probably already advised you to stop taking them for 48 to 72 hours during an episode of dehydration. If you continue to take these medications while dehydrated, they can cause harmful effects, such as a drop in blood pressure or damage to the kidneys. Other medications not related to diabetes may also need to be stopped during an episode of dehydration. Speak to your medical team to see if any other medications you are taking need to be stopped. To help you speak to your medical team about this, you could use the document entitled What to Do When You Are Ill and Have Type 2 Diabetes that can be found on the Diabetes Quebec website. You could use this as a checklist. You could find the download link to this document in the description of this video. It could happen that you forget to take your medication. In this section, we'll focus on what to do if you accidentally miss a dose of your oral or injectable anti-hyperglycemic agent. For most medications, if you remember a forgotten dose close to the usual time of taking it, you could take the missed dose. However, if you forget to take acarbose or glucobay, exenatide or Byetta, lixisenatide or adlixine, or oral semaglutide or Rybelsus, regardless of when you notice your missed dose, do not take the skipped dose. Wait until the next usual time before continuing to take these medications. It's also important to remember to never double the dose of an anti-hyperglycemic agent to make up for a skipped dose. For DPP-4 inhibitors and SGLT2 inhibitors, there's slightly more wiggle room. If you remember a missed dose within 12 hours, you could take the skipped dose. Otherwise, wait until the next usual time before continuing to take your medication. Semaglutide or Ozempic is injected once per week. If you forget your weekly dose, but remember within 5 days, you could take the skip dose and then continue with your normal schedule. If you pass the 5-day threshold, wait until the next usual time before injecting your semaglutide. As you can imagine, it is ideal to take your medication as prescribed by following the dose and time for taking it. For a person with diabetes, it's best to keep to a regular schedule. In general, medications are prescribed daily with breakfast, lunch, or supper. If this typical schedule doesn't follow your schedule, speak to your medical team. They could adjust your medications to follow your habits and not the other way around. Weight loss may also increase the effect of some medications, and the dose may become too high. If you notice you have lost weight, speak to your medical team. They may need to adjust the dose of certain medications. Some medications for diabetes need to be taken with food. If you're eating away from the home, such as at work, school, or at a restaurant, be sure to find a practical way to have your medications with you. To conclude this section, here are some general recommendations. Knowing how your medications work and their potential side effects can help you better predict the effects they may have on you. This course was intended to give a general overview of the drugs currently in use. To get more information about the specific medications you use, your pharmacist is your best resource. This is why we encourage you to build a relationship with your pharmacist. Over time, they will get to know you, your file, and your habits, and will be able to give you recommendations tailored to your specific needs. Be sure to speak with your pharmacist before beginning any over-the-counter medication or supplements. There may be specifics to consider depending on your medical condition. This course has been made possible with the financial support of Roche Diabetes Care, a division of Hoffmann La Roche Limited.